Itchy scalp is such a widespread problem like you wouldn't believe. Many people suffer from it, and I do mean itchy scalp that is persistent, that sticks around, that really bothers the hell out of you. You just keep on scratching, you don't know what to do. In this video, we'll talk about various causes that bring on itchy scalp, what can be done in the first place, and what to avoid not to make your situation worse. So the most common condition that induces itchy scalp is obviously dandruff. Dandruff is a very common condition. We think it is associated with sensitivity, yeast that are found naturally on the skin of the person suffering from the condition. The condition is usually treated very effectively by anti-dandruff shampoos or anti-dandruff topicals, and in more severe cases, it can be made better by application of topical steroids, especially the more inflamed cases of dandruff. Now, very, very importantly about dandruff is that a lot of people go overboard with treating dandruff by using shampoos to the extent that it actually dries out their scalp. That can wind up drying out your scalp, and you can end up with dandruff that is really dry scalp. That can mean that the cure is worse than the disease. So be very, very mindful. If you have dry hair, avoid using shampoos to the best of your ability. Try using anti-dandruff conditioners, which are not as drying to the scalp, or even applying antifungal creams, usually prescription antifungal creams, to the affected areas on the scalp. That could be a great way of avoiding drying out the scalp and making your condition worse while trying to treat it. Seborrheic dermatitis is a few steps up from dandruff. It's dandruff's inflammatory cousin. Seborrheic dermatitis is thought to be caused by sensitivity to yeast that grow naturally on the skin. The sensitivity induces an inflammatory response, and that inflammatory response can affect the scalp, can affect the face, can affect the armpits, can affect the chest area, and in some cases can affect the groin and the genitals. Seborrheic dermatitis of the scalp can be treated very similarly to dandruff with antifungals. The same rules that I talked about with dandruff apply here. And at the same time, seborrheic dermatitis may require you to use anti-inflammatories, specifically topical steroids, to alleviate some of the irritation and the itch that you're feeling. Seborrheic dermatitis, much like dandruff, is a chronic condition. It sticks around, it doesn't go away altogether, but you can't actually get it into remission. And remission is your goal. Once you get into remission, you can actually maintain that remission and hopefully be symptom-free. So see your dermatologist about that and make sure you're getting the right diagnosis, the right counseling and approach, and actually getting the results that you need, usually within a few weeks of treatment. Psoriasis is another condition that can affect the scalp and can lead to itch and burning of the scalp. Psoriasis is an idiopathic condition. It's thought to be autoimmune. It causes red areas that are covered with silvery or white scale. Those areas can be itchy on the scalp. The treatment for psoriasis is versatile, and it can be treated topically with topical steroids or topical vitamin D analogs. In some cases where the condition is resistant to topical treatment, systemic treatment may be needed to lead to remission. Sebopsoriasis is a hybrid of seborrheic dermatitis and psoriasis. It looks like a hybrid of both. So sometimes it can look like salmon pink areas that are covered with silvery scale. Sometimes it can look like red areas that are covered with silvery scale and can be more of a sebopsoriasis element. The importance of sebopsoriasis is that it can respond to treatments that work for both conditions, but every patient is unique. That needs to be clarified and determined so you're actually using the right treatment and getting consistent results. Contact dermatitis is a big problem on the scalp. In many cases, it can be caused by hair care products. In some cases, it can be caused by people dyeing their hair with an allergy, usually to paraphenyldiamine, which is an ingredient in hair dye. And in those cases, what you're going to get is something that looks very similar to either seborrheic dermatitis, in some cases even psoriasis. You are going to get that redness and flakiness on the scalp. In addition, you'll get itch. One important difference that we usually see in cases of dermatitis versus seborrheic dermatitis or psoriasis is that they are usually pretty widespread, because think about it, you're applying the inciting agent to the entire scalp. If you're using some sort of a shampoo that is causing the symptoms, you're allergic all over the scalp. If you're using hair dye, you're dyeing all of your hair, so the response is pretty widespread. Psoriasis and seborrheic dermatitis are usually more contained, in affect usually discriminate areas on the scalp, but that diagnosis does have to be made, sometimes by virtue of a biopsy, if we have to go there and distinguish between all those conditions to make sure that we know what it is that we're treating, and then take the next few steps to get you relief and make sure that the condition stays in remission, stays away. In the case of allergic contact dermatitis, eliminating the offending agent and treating the condition to remission will likely result in the condition not coming back. Same goes for irritant contact dermatitis. Those conditions will stay away as long as you avoid the agents or the factors that induce the condition in the first place. For seborrheic dermatitis or psoriasis, that will not be the case. Those conditions are self-powering. They will come back in most cases. They will bother you. So it's important to be on top of things and make sure they don't come back by using what's called maintenance therapy, meaning treating periodically to make sure the results that you achieved with the initial treatment remain in remission. Lichen planopilaris is a condition that affects the scalp and the hair follicles. It is a form of inflammatory condition of unknown causes. It can lead to severe itch and redness of the scalp and can also lead to hair loss, which is a big problem because lichen planopilaris can lead to hair loss that is actually scarring or permanent. So it's very important to distinguish lichen planopilaris from other conditions that affect the scalp because that condition can lead to results that are irreversible with relation to hair density. So if you're experiencing those symptoms and they are not quite readily responsive to topical treatments or maybe even systemic treatment, that may be time to biopsy the scalp and make sure that we understand what's causing your symptoms and what is the best way to treat this condition. We have to stop the itch, we have to stop the irritation, we have to make sure that you get relief and that your condition stays in remission. So that sometimes will require scalp biopsy to make sure that we understand what is going on in case we can't distinguish your condition from other conditions just visually looking at it or by treating it and making it go away. Some cases of itchy scalp are what we call primary itch. That is a condition that I've spoken about in other videos. That is a condition that can affect certain areas of the skin without a rash, without a skin condition, without any visible signs of anything that could be causing the itch. It obviously needs to be distinguished from the previous conditions that I've mentioned because those conditions are treatable. In many cases, they're treatable by application of topical medicine. In some cases, they're treatable by systemic medication, but they're definitely treatable and there is a specific treatment that works for each condition. Primary itch is a condition that is usually idiopathic. We're not sure what causes it. The leading hypothesis is that this is a condition that is caused by some sort of malfunctioning nerve endings and can be caused by other factors on the scalp. That being said, that condition must be distinguished from other conditions that cause itch on the scalp, treat it appropriately, and get you relief. Treating primary itch on the scalp is certainly not easy because the condition is pretty rare and there are many test cases with treatments that work. We do have to look around for the one thing that will work for you. But if that's something you're suffering from, my suggestion to you is first of all, see a dermatologist to find out what it is that's causing your itch. Second, follow up consistently to make sure that you're actually evaluating the treatments as you go and making sure that you find the right treatment for you and ultimately getting you the relief that you need. If you've enjoyed this video, share, like, and subscribe. Put a comment in the comment section and let us know what kind of scalp itch are you suffering from and how have you been able to find relief for your condition. More great content coming your way right from this channel. Thanks for watching and God bless.